Hi, this is Dr. Epstein with a patient who is only 29 now. I did his procedure 6 years ago. There's a lot of debate over whether you should do hair transplants on young guys, under the age of 25. Some of the concerns include them continuing to lose more hair and not knowing how much more hair they're going to lose. Second thing, the big issue is that younger patients tend to want more conservative, more radical or dramatic hairlines, i.e. a lower hairline, and in those cases I just don't think those patients are realistic, and therefore I usually will not do a procedure on them. And this is a case of a patient who, as I said, did his first procedure with me when he was 23, did around 1,450 grafts. This was in 2004 approximately. He's now 6 years later. We're doing a second procedure on him, and I want to show the results, and it made a big difference. Now, while he has lost a fair amount more hair and he hasn't been on Propecia, which he is going to start taking to hopefully prevent the progression of loss, he has basically held on to a frontal forelock. In addition, his donor side healed up nicely. Let's go ahead and take a look at him, and you can see all this hair here, this whole frontal area, was transplanted. Now I've marked him out. We're going to do another procedure on him because he's got such nice donor hair and he hasn't lost much hair and he's held on to the crown. But what the focus is going to be going ahead and filling in this frontal area, but I'm also going to restore some temporal points. Going to go within the lines, but you can see how I've drawn in. So he's really held up nicely, and considering this was done 6 years ago and he's lost just about all his other original hair, it really is held up very nicely. In terms of his donor site, you can see over here, he really healed in pretty darn nicely. And you can see that donor site scar. We're going to continue. We only did this much. I'm going to go ahead and use more on the right side and come back this way, cut out most of that old donor site scar. So anyway, this is a case of a young patient. The importance of planning for future hair loss today, as I've marked him out. He understands that he is at risk for losing more hair, and so that's why he's accepting the recommendation of mine that we do a fairly conservative hairline. He should do real well. He's a little nervous, but he's starting to relax a little bit. This is Dr. Epstein. Thank you very much.